The United States is at a time of promise for historic transformation in mental health care. Can the healthcare industry harness this opportunity to come together on behalf of those in need? America's mental health has been struggling in recent years, and millions of Americans, including many healthcare professionals on the front line of battling the illness, continue to grapple with the mental health challenges arising from the pandemic. However, our current mental health system is not set up to serve those who need the most help. Recent research released by the Satcher Health Leadership Institute at Morehouse School of Medicine, The Economic Burden of the Mental Health Inequities in the United States report, demonstrated tangible evidence for the first time that investing in mental health care directly contributes to saving lives and dollars. The clarion call to remedy these issues is clear and urgently sounding. The real question is how bold the healthcare industry can be in driving and sustaining systemic change that addresses the challenges. One healthcare company chooses to view this as a positive opportunity to bring forward transformation on behalf of those living with mental illness. Otsuka America Pharmaceutical Inc., a leader in mental health care, poses a thought-provoking viewpoint meant to encourage radical changes across spectrum of care. What if the world valued every mind? They assert that decisive and transformative change to the U.S. mental health landscape is possible if politicians, public administrators, advocates, and policy experts coalesce around a focused set of objectives. Diagnosed patients have long faced a lack of parity in treatment and resourcing for serious mental illness, when contrasted with other chronic conditions such as diabetes, heart disease, and cancer. Otsuka takes the transformational viewpoint that mental illness is chronic, not an acute or temporary condition. This perspective leads the organization to work across the spectrum of care as they promote decisive and transformative change to the U.S. mental health landscape in an effort to improve the lives of the millions of Americans living with mental illness. The organization is committed to igniting conversations that will help every stakeholder fully appreciate that mental illness is a chronic, not acute, or temporary condition, and should be resourced and treated as such by policymakers and all stakeholders in the mental health community. Considering the global shortage of mental health professionals, the barriers to care faced by millions, and the suboptimal responses to treatments experienced by patients, it is critical to explore new and novel approaches to expanding access. Despite a large industry exodus from this area for many years, Otsuka has been committed to providing new products that contribute to patients worldwide in the field of neuropsychiatry.